session is going to be all about health-related courses, mainly nursing programs. We have a very special guest, Dr. Geons from Institute of Health and Management, a very well-renowned provider who have been running nurses courses for ages now. And they have programs at diploma level as well as at higher education level, and especially their Masters of Nursing, which has become quite popular in the last 1 year. So welcome, Dr. Geons, to the live session with Aussizz Group.
Thank you, Sari. Thank you for that warm introduction. And thank you, Aussizz, for giving us a chance to discuss about the nursing in Australia. Yeah.
Thank you. So in today's live session, what we'll be discussing about the courses which are available with Institute of Health and Management. So the courses mainly talking about Diploma of Nursing, the Masters of Nursing. They do have a graduate certificate in nursing, and a very popular course, especially for overseas registered nurses. The students who have done their BSc nursing or the GNM nursing from India, or the PCL nurses from Nepal, or the BSc nursing holders from Philippines. A lot of overseas nurses who are registered, who are practicing in their home country or in other countries, and they now want to move to Australia. So they are looking to get themselves registered. So what is this NCLEX? What is OBA? What is this whole hoopla about? Because students are still confused as to how exactly to apply for it, because they don't have a very clear answer, and they are very scared of the exams as well, and it's quite costly. It's not an exam which they can take again and again, because obviously it's a big financial thing for international students. So we'll be taking out all those we'll be talking about all those topics today. So guys, if you have any questions, any nurses here or any students whose partners are nurses, or who know any nurses from back home who are looking to move and become a registered nurse in Australia, please tune on to this session, and please leave your questions in the comments. We'll be going through those questions as well. Thank you. So I'll hand it over to you, Dr. Geons, if you can give us a little introduction about yourself, because you have been a pioneer in this industry and with IHM as well.
Yeah, of course. Thank you, Saru. So I am from Institute of Health and Management. Institute of Health and Management is one of the higher education provider here in Australia. So definitely for overseas registered nurses, you will be having someone who studied with IHM. And maybe if you visit any of the hospitals, there will be someone who studied at IHM or our sister institute, Institute of Health and Nursing Australia, because we were offering bridging program quite a long time now. In 2020 March, Nursing Midwifery Board of Australia, they have changed the registration process for overseas registered nurses. Since then, we started hearing the term OBA, that is outcome-based assessment. As Saru clearly mentioned, that is something worrying or the concern for all overseas registered nurses, because they are scared about the exam. But in my personal opinion, you don't have to worry. So NCLEX is the first part. It's an exam, it's an online exam. And the second part is OSKI, that is Objective Structured Clinical Examination. So both NCLEX and OSKI is not a new process for registered nurses. If you consider US registration process, NCLEX is there for ages. And OSKI is something which we already have in our Bachelor of Nursing or even our leading to registration master's program. Because before sending any nurse for a clinical placement, providers need to evaluate their eligibility, their qualification, and the OSKI was part of it. Currently, even nowadays, OSKI is running as part of the leading to registration process. So that is a new registration process. Instead of bridging program, which was there before, now it got replaced with NCLEX and OSKI. And compared to the previous 3 months bridging program, it is less expensive for overseas registered nurses. But training is important. That's where we are. So we have training programs available for overseas registered nurses, both for NCLEX RN and OSKI. So we hold almost 650 overseas registered nurses who studied NCLEX RN course, and we are the largest provider of NCLEX preparation program here in Australia, and more number of students are joining day by day. So don't worry if you are scared about NCLEX or OSKI exam. It is possible. It's not an impossible exam. Compared to all other health professionals, nurses are in high demand in Australia, and Australia needs nurses. So you just need to prepare, and we are there with you to support you to clear NCLEX and OSKI. So that's about NCLEX and OSKI. Saru?
Thank you, Dr. Geons. I just have a few questions about this preparation course. So when it comes to NCLEX, as far as I'm aware, it's an objective type questionnaire, which a lot of students, even, who are nurses back home, they take it online. So it's an online exam. They necessarily don't need to be in Australia. But for OSKI, because it's a practical exam, so what does OSKI actually involve? Like, there are some simulation, some exams that you have to take. So if you can give a little clarity on that.
Yeah, of course. So if my reading is right, like OSKI got started in 1988, or since then OSKI is part of the nursing programs or even in the medical sector for a long time. Okay, so OSKI means maybe overseas. OSKI is part of the medical courses, like there will be a live patient, the doctor or the medical student or a nursing student, they will be taking case scenarios and they will be discussing the case and giving them a solution, or they will manage the scenario. Here in Australia, it's a bit different. Here we use mannequins. When the hospital bed will be there, the patient won't talk. It's not a live patient, it's a mannequin. So there will be someone who will be acting like a patient, standing nearby to the mannequin, and there will be an examiner inside the exam center. So as I mentioned earlier, OSKI is part of the Bachelor of Nursing program, even our Diploma of Nursing, or previously when we were offering bridging program, it was a 6 weeks theory class happening, and after that we will be sending our students to a clinical placement. The fact is, there was an OSKI exam happening in our campus before sending our nurses to the simulation. So this part, no one is aware about this part because it was regular pattern. Everyone is aware about that bridging program happening. It is easy to pass bridging, but it is very difficult to pass OSKI. But the fact is, all the 20,000 nurses whom we sent, or at least like the 2,500 got registered in last 2 years with IHM, they all had undergone the OSKI examination. And only if they passed OSKI, we used to send them to the clinical placement centers for the 6 weeks clinical placement. So all our labs are having the OSKI setup, and all our educators were conducting this exam. The only difference is now this exam is conducted by the nursing board, the authorized examiner, but simulation or the scenarios are different, but nothing. Healthcare, cardiac arrest is always cardiac arrest. It won't be different in India or in Philippines or in Australia. So the way we manage in these countries are different. So to be short, if you can perform, if you are practicing, it's a bit challenging if you're straight away coming from an overseas country, and if you're just giving this exam maybe after 1 week in this different scenario, it's entirely different. So if you get 1 week of practice, it is possible. Same like we drive in our own country. If you are getting some lessons here in Australia, and if you are driving properly with an educator, we can pass driving test, isn't it? We can't guarantee, but there is a high chance. If you fail, you can give again. It is expensive compared to driving, but it is not impossible. It is not that hard as you think. It is there, and all the nursing students in Australia are going through OSKI. Okay. So hope that
that's a very important point that you have brought forward, because many students are not aware of this. Even before our last meeting, I wasn't aware that OSKI is still a part of the Bachelor's of Nursing or the Diploma of Nursing or the 1-year bridging program which students are taking. So sometimes we get students, they are like, oh, I'm scared of OSKI. I would rather go and do, get my credits from Bachelor's back home, do 1-year study here, complete Bachelor's of Nursing, and then get registration. But as you explained, that OSKI will still be a part of it, that program as well, because before going into placements, obviously they need to understand.
Yes. Before going to work in Australian hospital, nursing board needs to understand that you are qualified, you are equipped. So this is the same test. So over there, it is happening in the provider. Now it is happening in Adelaide Health Simulation Center with the nursing board. So don't underestimate what is happening inside. It is possible. It's not nothing new. Even if you are going, if you think that there are shortcuts like studying or other course, this course, but the best option the nursing board is advising you is to go through this OSKI. You are a qualified nurse overseas. So why are you worried about giving that, demonstrating that knowledge, demonstrating that skill which you have, which you acquired from an overseas country? Okay, but if you have that 1 or 2 weeks practice, we have 2 weeks OSKI preparation available in all our 3 campuses in Melbourne, Sydney, or Perth. So the 2 weeks is more than enough for you to manage your time. It's all about managing the time. Okay, if you visit our website, like in the OSKI course page, there are a lot of testimonies where students who cleared OSKI in their first attempt telling it is about managing the time. It is about using the right bed, right equipment which you have in the exam center. If you have these skills, it's possible for you to pass. Okay, that's all is happening inside the exam center. Hope that is clear for you.
Yes, definitely. And Dr. Jones, what is the actual price for this exam for OSKI?
Okay, so it's 4,000 Australian dollars when it comes to OSKI, and NCLEX is around 450 Australian dollars. So compared to the previous bridging program at IHM, 3 months course was having 17,000 Australian dollars. It was a non-awarded program. Compared to that previous bridging program, you know the difference between the
Yes.
process. So nursing board has done which is beneficial for overseas registered nurses. And when I've talked to different nurses from different countries, some countries, like some nurses are very confident to give this exam, some others are scared about this exam. So it's all about our own attitude, and it is nothing new when you compare about other countries. UK already have this CBT. Instead of NCLEX, they call it as computer based test. It's an online test, and after that they also have practical. US also have this practical, and Australia started this from 2020 March. Okay, so it is possible. Nothing is new. Only the system or the technology wise, small difference, the pattern, the way of managing patients, and the diseases, maybe it will be different, because you can't find those diseases which are common in Southeast Asian countries. It will be different in Australia.
That's true.
But we are there to help you.
Yeah. No, thank you for that, because I just want these students to understand that if you're spending 4,500 on an exam, then please spend some time in actually preparing for that exam as well, and enrolling for the right course rather than just blindly giving it a go. Because spending 4,000 for that OSKI exam is not less amount for any international student. So if you are going to spend that much money, at least I would advise, it's a genuine advice that, take the right approach, get the right guidance, and from a provider which has been in the industry for so long and they have been running the bridging program, they understand that. So at least get the right guidance before going for it and before making that move. And a very right point that, instead of spending 17,000, 18,000 on the bridging program, which used to be the program earlier, or even the bachelor's of nursing, if you're already an overseas qualified nurse, you're a registered nurse, then it's better to spend that money in the right way and use that OBA program which the nursing board has given you. So rather than taking it, thinking of this as a disadvantage or negative, I think this is positive that the nursing board has given this as a positive solution for overseas registered nurses. And the solution is already there in US and UK. Now Australia has brought it. So let's welcome this with open arms, and let's go for it, I would say. So, and let's not be scared. Let's just get the right guidance about this. And so the OSKI preparatory course you said is for 2 weeks. And what about the NCLEX? What's the duration for that program?
So the NCLEX course, we are offering that online, and we are offering that for 12 weeks, almost 3 months, with 500 Australian dollars. That is the cheapest. Or with this much facility, with this learning management system which we offer, it is just $500 for the overseas registered nurses if you are looking forward to study NCLEX. And apart from this 2 weeks OSKI, Institute of Health and Management is also offering an exciting course for overseas registered nurses. Okay, so that is graduate certificate in advanced nursing, Australian nursing practice. Okay. I would like to talk about that course.
Yes, please.
So this course is for 6 months. It's an accredited course. It's accredited by TEXA, Tertiary Education Quality Standards Agency. It is a postgraduate AQF level 8 qualification, which includes 4 weeks of OSKI preparation and 4 weeks of clinical placement. Okay, so it got 3 subjects. It's for 6 months, and within this 6 months time, you will be studying the theory portion about Australian nursing practice. That's a specialization. You're going to be a postgraduate specialized nurse if you're studying this. It also includes 4 weeks of OSKI. So previously I discussed about the 2 weeks of OSKI is enough to clear this OSKI exam. Here we are discussing about 4 weeks of OSKI. After that, after this OSKI preparation, we are going to send you to a clinical placement, to a healthcare facility. Same as I mentioned about the Bachelor of Nursing course, all other courses which is leading to registration. But this course won't give you direct registration. This is a qualification. And after that, after getting this OSKI preparation and working in a healthcare facility, you will be more confident than the 2 weeks course which I mentioned earlier. There is no reason for you to fail, isn't it? Are you getting confidence? I'm confident about this. Okay. So it's a 2 months preparation, and you are getting a postgraduate qualification. So the money which you are investing, it's not just for a training preparation program. It is actually giving you a qualification. Once you clear the exam, then you will be a postgraduate qualified Australian registered nurse. That makes difference. So if you are an overseas country, if you're watching this video, you can be here in Australia on a student visa if you're studying this course. It's for 6 months. Okay. Once you clear this exam, then you will be a registered nurse. If you would like to further continue your education, continue with a Master of Nursing, you will be getting full credit transfer into the of the first semester of masters. So you can continue it from the second semester. Okay. So that, I hope that is giving you a sense about the value of this course. Or if you're just interested to prepare for 2 weeks OSKI, we have other option. If you want to gain a qualification after this preparation, go for Australian nursing practice specialization.
That's a great program, Dr. Geons, especially for nurses and students who want to come to Australia on a student visa, or who are here already on a student visa, or maybe on their 485, and or their 485s are expiring, but they have some nursing background study. Maybe they've come here for a master's of, we see a lot of nurses who have done BSc nursing, they come here to study masters of public health. They are on their TR and they don't know what to study next, or how to go about it, how to go about the registration process. So I think this is a very right course for them, and it also leads, also the student can start with the second year of masters of nursing, which is great. So when it comes to the entry requirement for this course about academic and English, so what are the entry criteria there?
So the entry criteria remains the same. It's overall score of 6.5 in IELTS or equivalent test, and no band less than 6. We also have English for academic purpose course available if you have overall score of 6 and no band less than 5.5. So that pathway option is also there. So with those options which you mentioned, Saru, apart from that, this course is a postgraduate qualification. So if you have completed your Bachelor of Nursing here in Australia, if you want to have that 1 month clinical experience in one of the hospital, then this course is for you. If you are from Hong Kong, if you are from UK, if you are from those countries which will give you direct registration in Australia, if that Australian experience is lacking, this course is for you. So it is not just for overseas registered nurse. Overseas registered nurse is one group which we can enroll into this course, because that is helping them for the OSKI preparation. But this course is for all bachelor degree holders. If you want to experience Australian hospital or Australian health practice, or Australian OSKI preparation, OSKI part, then this course is for you. For if you are an overseas registered nurse with all other criteria which Saru just mentioned, this will help you to equip for the OSKI preparation. Okay. Yes.
Thank you for that. And what the entry requirements? So student needs to have done a bachelor's to get entry into this graduate.
Yes. You should be having a bachelor degree, or if you have 3-year diploma qualification, then if you have 3 years of experience from overseas country, then we can take you into this course. Okay. So 3-year diploma holders means, like if you take India, general nursing and midwifery, Sri Lankan diploma nurse, and even from Nepal, if you have done that 3-year diploma after year 12. So it's not PCL nurses. So if you have done 3-year diploma after year 12, or there are many Nepal nurses from Nepal who studied diploma from India. So, or from some of the African countries, they got 3-year diploma, and the designation should be a registered nurse, not an EN. If you are a diploma holder in nursing, working as a registered nurse, if you have studied that course after year 12, then we have an option for you. Even you can complete Master of Nursing. That is the fantastic opportunity for those 3-year diploma holders through this pathway. And after completing the first semester, they can start with the nursing board process to get registration.
So that is one thing which I was coming to next, because a lot of students who have done this GNM nursing from India, which is considered as a diploma in India, but the registration is as a registered nurse. So earlier they used to have one or the other pathways. So is this the right pathway for them to become an RN in Australia?
Yeah, so because at Institute of Health and Management, we are taking those 3-year diploma holders minimum. If they have 1 year experience, we have graduate certificate in nursing, non-specialization course. If you got minimum 3 years of experience, then we can take them into graduate certificate in advanced nursing, Australian nursing practice specialization. Apart from this specialization, IHM also got 13 other specialization in nursing and Master of Nursing. So when we discuss about this NCLEX and OSKI, you should be having that confidence about studying that exam preparation with a provider or with a college who offer up to master's level with 13 other specialization course. You won't be disappointed. You have everything you need to pass this exam. That is the confidence which we can assure you if you are scared about this exam process.
Thank you, Dr. Geons. I'm sure the students would get that confidence now that you're sharing such information, because many students are not aware about this. So unless and until they get to know that, the kind of specializations that IHM offers, and with so many programs, and sometimes the pathway is not clear to them, but now they understand that this is the path which they have to follow. So I think step by step, they will definitely get there, and we'll have some good experienced nurses with training from you guys working in hospitals here. So the next thing which I wanted to talk about is the Masters of Nursing program. So what are the entry requirements for that Masters of Nursing?
Masters of Nursing also got the same requirement, same as graduate certificate in advanced nursing. You should be having a bachelor degree, or when it comes to English, 6.5 hour roll and no band less than 6. If you are a 3-year diploma holder, as I mentioned earlier, you can go through GCAN pathway and enter into the Master of Nursing, provided if you have minimum 3 years of experience. If you got only 1 year experience after the 3-year diploma, then we have GCN pathway to Master of Nursing. So the course is for 2 years, and those overseas registered nurses coming from an overseas country, like definitely they can go through GCIN, prepare for their OB exam, OSKI, give the exam and continue with the Master of Nursing. That pathway is also there. But if you have completed bachelor degree, experience is not required to join Master of Nursing course.
So could it be any bachelor's?
Bachelor's in nursing, bachelor's of nursing. So our master's is only for registered nurses, either in Australia or from an overseas country. So bachelor degree in nursing or diploma of nursing is the qualification which we require to study master's at IHM.
Okay, so they do need that RN registration.
Yes,
in Australia. Registered nurses. Yeah. Okay. And that means the 1 year work experience is also so for bachelor's you don't need any experience.
They should be a registered nurse and a bachelor degree holder if they are looking for the master's of nursing. Okay, but if they have 3-year diploma, then they should study for at least 1 month. Master of nursing.
Okay. So when it comes to these programs, what are the locations where you are offering these courses? Because IHM has multiple campuses in Australia, and also which are the next intakes we're looking at?
Okay, so we have intakes starting from July, November and March 2023. We got 3 campuses across Australia right now. That is in Melbourne, Sydney and Perth. So March, July and November intakes, Melbourne, Sydney and Perth.
So all the courses are available at all these campuses?
All the courses are available at all these campuses, including 2 weeks OSKI preparation. And NCLEX is definitely, it's online. 2 weeks OSKI preparation, 6 months GCIN specialization and Master of Nursing, all available in all our 3 campuses, Melbourne, Sydney and Perth.
Okay, that's great, because students are moving so much interstate, a lot of movement from Melbourne to Sydney. And now with the recent budget announcements, a lot of students are making that move to Perth as well. So I think this will definitely come in handy for students, who are moving interstate as well. And a lot of students, even from overseas, are coming to study in Perth, and they're choosing Perth over other cities at the moment. So I think that's great. And NCLEX, as you said, it is an online preparation course. So even, students who want to do it from overseas, they can still do it. And then for OSKI, they can come here with the visa and, do the OSKI preparation course.
Yeah, that's right. Yeah. So to prepare for OSKI, if you are looking for a student visa, GCIN is the best option.
Yes.
So if you are coming here on a visitor visa just to give exam, then 2 weeks OSKI preparation is the option for you. So we have custom made options for all those registered nurses. Looking forward to be a registered nurse here in Australia.
Great. So as we were talking about these overseas registered nurses, just one question I think which was left is the students who have done this GNM, the Graduate Diploma of Nursing, because what the nursing board says is that their qualification is not equivalent to a bachelor's level, which they require minimum. So I remember when IHM introduced the graduate certificate of nursing in starting, we sent a lot of students of GNM nursing who then completed the graduate certificate and then used to go for the bridging program.
Yeah,
So with these students, is this pathway still there? Like they do their GNM nursing from India, and then they do the graduate certificate with IHM, and then they can do the OBA program.
Yeah, that's right, Saru. So we are offering graduate certificates since 2015, 2016. Since then, Aussizz is giving good or recommending this course for many of our students. So if you are a GNM nurse, you have an option to study graduate certificate in nursing if you got minimum 1 year experience. Okay, so studying this qualification will upgrade your qualification into AQF level 8, because nursing board require minimum bachelor degree, that is AQF level 7. So here in Australia, we got different qualification levels. So bachelor degree is level 7, graduate certificate is level 8, masters, any masters, it's level 9, and 10 is PhD. So nursing board require minimum level of 7 for an overseas registered nurse to be a registered nurse in Australia. Even if previously it was bridging program, now it is OBA. To qualify for this OBA, you should have AQF level 7. So GNM nurses are not eligible because of their qualification from overseas, that is coming to AQF level 6. Studying this 6 months course will improve your qualification or upgrade your qualification to level 8. Then you can do the same process as an overseas bachelor degree holder. Then you can start with the OBA process. Okay,
that's amazing. That's, that pathway is still open, because I remember when the OBA program was introduced, the GNM nursing especially, they were stated that they don't have that pathway any longer. But because there was a lot of confusion then, so I think this gives a clear idea for those nurses, because there are a lot of students who have done GNM nursing, because it's strange that their registration is still the same. They're still registered nurse. Doesn't matter whether they have done a BSc nursing or a GNM nursing, and they pretty much work at the same position. They do the same job.
Yes. Even those countries, like those 3-year diploma holders, when we consider bachelor degree in Australia, it is for 3 years.
Yes.
Okay, this diploma holder studied for 3 years.
Exactly.
Overseas country, and their title is registered nurse. Here, after studying a diploma, it is enrolled nurse. So
Yes.
they are registered nurse. They have, in fact, some countries got more number of clinical placement hours when we consider here, but their qualification is diploma. So and the nursing board also have, it's like limitation to assess their qualification as well. Yeah, but they're coming to level 6. So being a registered nurse, they are eligible to study IHM's graduate certificate in nursing program. And we consider or we appreciate their experience and qualification.
So, and one more thing I wanted to ask, because last year, due to COVID, due to lockdowns, students actually were not able to get the bookings for OSKI, and OSKI was, stopped for a while, was put on hold because of, they could not practice that distancing there and everything. So, is it all okay now? Are the dates available, or are still there issues going on because of the backlog?
I think it's all okay now, according to the details which we can find in nursing board website. They normally schedule 5 exams in a year. So far, like, I think our students are getting dates, and I'm very happy to tell you that we got 100% result for OSKI. So far, whoever gave the exam after studying with IHM, OSKI exam, they have cleared. Okay, so because the reason I explained earlier, because if you're practicing in a well-maintained lab, there is no reason for you to fail until and unless if you are really making a big mistake. But we can handhold you to clear OSKI. So far it's 100%, but definitely only limited number of students gave the exam. That is also a fact. But now everything is back to normal. And the projected shortage of nurses by 2025 is almost 100,000 in Australia. Okay. So, and by 2030, the number is supposed to be increasing. So the demand for nurses are increasing in Australia, and Australia needs nurses, and we all need nurses. When you and me, when we both are sick, we are going to hospital. If there is no nurse, what will you do? Okay. So if you are a nurse watching this video, don't worry. Don't get confused to select Australia. Australia is the second country, largest country, paying good salary for nurses. great career opportunities. If you have studied a postgraduate qualification, you can even upgrade your work level into managerial role, and different roles and positions are available for nurses. If you are not interested to work in hospital, you can even become a placement coordinator. You can work as a nurse unit manager, or you can even become one of the educator in one of the provider here in Australia. We also need nursing educators.
Yes, yes. Dr. Geons, can you share, because of your experience, I'm sure, I mean, you deal with nurses on a day-to-day basis with students who qualify and get to work in hospitals. So what is a normal pay range that they start with, and going forward, what is a normal pay range that they're expecting if they're working in Australia?
So nurses are one of the highly paid professions. So if you got enough number of experience, then definitely you can get up to from $30 plus. Okay, and when you consider the hourly rate, okay, definitely you need to consider the night duty allowance, Saturday, Sunday allowance, and all other extra hours which you will be working. But you are one of the highly paid professionals in Australia, and you can't we can't justify them with just within one pay scale, because if you are really smart enough and if you are really dedicated, your possibilities are
Yes,
unlimited. Okay, so don't
exactly.
worry. Yeah. So this investment which you are making, investment in education will always be returned. Okay, so you won't be disappointed after doing all this effort. It's just your attitude towards learning and your interest in continuous learning. Okay, there is no shortcut to get into this field. Okay,
Yes.
so even if you are choosing a bachelor degree program, are you looking for a easy option? Still you need to study. Okay,
Yes.
still you need to go through this clinical placement, still you need to go through this OSKI. Okay, so even I am not telling you that we have a shortcut for you. It is impossible. You need to work, you need to practice, and you need to demonstrate your skill either to the university or the provider where you are going to study bachelor's or master's, or to the nursing board. So
Yes.
you need to select which one is better, either to give OSKI once and pass, or twice and pass, or study 2 years. Okay, so yeah, we all know the answer which we want to select, and
I
I
know.
don't want to tell you what you should.
I think, yeah, everybody who's listening to this session knows the answer to that question, that, and what is what is the path that students can take where they can get to the registration in least amount of time and least amount of money and least amount of, but yeah, effort wise, I won't say least amount, because when it comes to nursing, one thing which you very rightly said, Dr. Geons, is dedication is required. It's not a job which you can do just for the sake of doing. You have to be fully involved. So the same goes from studying nursing as well. Whether you're studying a diploma of nursing, bachelor's of nursing, the OSKI preparation course, the graduate certificate, anything in nursing, you have to be fully dedicated. You have to give your time. And time is not 1 or 2 days a week. Time means 4 to 5 days a week at least, where you have to be studying this course. Even with the bridging course, when it used to be, I remember it used to be 5 days classes, morning to evening, and there was no leave allowed for that course. That was a very high demand course then as well. So for this OSKI preparation or a graduate diploma of nursing, I'm sure the same involvement would be required. So definitely that amount of dedication is required when you're going to study nursing. It's not an easy decision to make. Just don't make make decision that nursing is in high demand, so let me just go for it. Just 7 each. I've got 7 each. Yes, let's go for nursing. It's a big decision. It's a life that you're choosing for yourself. So don't just choose it just because your nursing is so popular or nursing is in high demand. Choose a career in nursing and put your full involvement in that. It's only then that you'll get to that step easily and you'll enjoy what you're doing. It's a very rewarding career.
Yes.
It's not just for the sake of money. It's a highly paying, definitely, as doctor mentioned, that it's $30 per hour is the normal pay rate, which you get with some years of experience.
I mentioned because I don't want to give a lot of hope. Okay, that we can guarantee.
No, of course.
Starting from 60,000 annual salary in Australia, definitely no one will challenge me. You are telling wrong, but it is always high. I'm not telling that is the
exactly. Yeah, so we are not quoting you there, sir. So don't worry about that. But yes, so that's with some years of experience. But yeah, nightly allowance and everything adds up. And as he said, if you are smart enough, you can really have a very high paying job. And as I was mentioning, a very rewarding job as well. You'll have that smile on your face that you are helping someone in need. So it's a very rewarding career. Anything else that you would like to add, Dr. Geons, for all these courses? Anything that we missed out or anything that you would like the audience to know about?
Like we covered almost all the areas about nursing. So if you have any questions, please feel free to contact Aussizz group, and we are more than happy to help you. And Aussizz normally, like, they refer many students or they recommend these courses to many of the students. And there are many successful nurses who had gone through this process. So as Saru mentioned, you won't be disappointed if you are becoming a registered nurse in Australia. So yeah, thank you all for listening, and I wish you all very best, and we hope to see you on board at IHM.
Thank you, Dr. Geons, and thank you everyone to listening to this session today. I would just like to reiterate the fact that the courses available with IHM are Diploma of Nursing, the Graduate Certificate in Nursing, the Graduate Diploma in Nursing, and with more than 10 specializations, I think 13 specializations he mentioned, and then Masters of Nursing and the NCLEX preparation course and the OSKI preparation course. The NCLEX preparation is online and the OSKI preparation is the 2 weeks face-to-face, because it's simulation. Obviously, it has to be face-to-face. But then the graduate certificate of nursing, the advanced nursing, it has the 4 weeks of OSKI preparation included as a part of the course, plus 1 month of clinical placements also. So you're getting a full-fledged 2 months of actual practicing as a nurse, so that is the actual involvement. The actual practicals are involved there, and that will give you more confidence, more boost to clear your OSKI exam in the first go. So don't get scared of this exam. I would say this is an opportunity for all the overseas nurses to get their registration done in Australia as soon as possible, rather than going for 1 year or a 2-year bachelor's of nursing or a master's of nursing program. I think this is an opportunity which you should use wisely. And for graduate certificate of nursing, the IELTS requirement is 6.5. But if you have done a bachelor's of nursing, you do not need any experience. But if you have a diploma of nursing, the 3 years diploma, then you need 1 year of experience to get yourself entry into the program. And for their masters of nursing, they do need a bachelor's of nursing as a prerequisite, and also your registration as an RN. But for GNM nurses, they still have a pathway. They can do their graduate certificate of nursing, and after completing that 6 months course, they can go for the OSKI, the NCLEX OSKI, which is the OBA pathway, to get themselves registered as an RN in Australia. So you still have those pathways available, and they have campuses in Melbourne, Sydney, and Perth. The upcoming intakes are July and November, and then after that, the March intake. So 3 intakes per year. And guys, trust me, when it comes to IHM, they have a very long-standing history in health courses, and especially nursing. They are renowned, and they have very good quality, labs there, and good quality professionals who would give you hand-to-hand approach, and you would have that confidence after studying with them. So any more questions, please put it in the comment section. We will get back to you as soon as we can. And thank you for joining us. Have a good evening.
Thank you.
Thank you, Dr. Geons.
Thank you.